Good evening. This is Brian O'Clock News, bringing in today a topic of news about a virus that you and your family probably have or will obtain some point in your lives. In this segment, we will be talking about the sexually transmitted disease, human papillomavirus, also known as HPV. HPV is a virus that, as of 2024, and according to the CDC, can be transmitted through skin and skin contact with an infected person. With over 42 million Americans obtaining different types of HPV infections in their lifetime, HPV, human papillomavirus, is a sexually transmitted infection and disease that can lead to serious complications. According to the National Cancer Institute, there are more than 200 types of human papillomavirus, with around 40 types that can infect the genital area. With over 200 types of HPV types, of most of them that do resolve on their own with its own antibodies in a couple of years. If the infection does not clear on its own and there is no treatment provided, it can eventually lead to cancer. HPV is transmitted through sexual transmission, spread through vaginal, anal, or oral sex. The use of condoms can protect against HPV, however, it is not guaranteed. First, we will talk about the two most common types of HPV, which are 6 and 11. Type 6 and 11 of HPV are to be considered low-risk HPVs that tend to cause cauliflower warts in the genital area and also laryngeal papillomas, with some types of HPV 6 and HPV 11 causing malignant lesions. These two types of HPV can usually resolve on their own in a couple of years. Up next, we have a variety of HPV types that are more serious and tend to lead to cancer. According to the National Library of Medicine, HPV types 16, 18, 31, 33, 35, 39, 45, 51, 52, 56, 58, 59, and 66 are HPV types that are prone to cause cancer, with HPV types 16 and 18 becoming more popular and also being the main cause of cervical cancer. These types of HPV are considered high risk since there are no warts to identify the virus, and it progresses into cancer. Now we are informed of what HPV is and the different types. Let's dive a little deeper into understanding what exactly is HPV on a microscopic level. Research from the textbook Microbiology helps us understand that the official name for genital warts are referred to as Condylomyia acuminata, and HPVs that cause cancer are also named oncogenic HPVs, which would include oropharyngeal cancer, anal cancer, vaginal cancer, vulvar cancer, and penile cancer. HPV is a small, non-enveloped virus with a circular double-stranded DNA genome. HPV cannot be cultured, therefore a vaginal test is performed. We must notice that HPV screening for males is not common. For women, it is included in the guidelines. In order to perform a screening test of HPV in women, a medical professional would take a sample of cells from the cervix, as we can observe here in the picture, and observe for the HPV DNA or RNA. For a pap smear, a medical professional would also take samples from the cervix and observe under a microscope for abnormal cells. If there is a presence of abnormal cells under the microscope, then we identify them as chorocytes, which have a nucleus that stains darkly and more nucleus than cytoplasm. We can also observe a halo around the cytoplasm. So in this picture, we can see on the right side, your left side, this is a perfectly healthy cell. Right here on this side, we can observe that the nucleus is expanded and this halo that is around the cell. Okay? The process in which we can stain to view these cells is by obtaining the sample and placing it into a liquid-based cytology medium. Then they are transferred to slides through the process of cytocentrifugation. The slides are then air dried and treated with acetone or formalin to then be incubated into anti-P16 and anti-Ki67 antibodies, which bind to the P16 and the Ki67 antigens in the cell. After rinsing, they are combined with enzymes or fluorophores, such as red chromogen or brown chromogen. We will then view a red or brown stain, which in the final steps, the slides are dehydrated with graded alcohols and xylene. Through the process, hope is not lost. Vaccines such as Gardasil vaccine includes types 6, 11, 16, and 18. Gardasil 9 vaccination for types 31, 33, 45, 52, and 58. And the Cervarix vaccine, which includes just HPV type 16 and 18. Through time, vaccination has proven itself to be the best competitor against oncogenic HPV infections. But it is important to note that not all oncogenic HPV infections are covered by the available vaccines. But due to a grand variety of types, we must recommend that teenagers get vaccinated before they have sexual intercourse. Thank you for your time for these breaking news on Brian O'Clock.